Welcome to the weekly meeting of the Rotary Club of Jonesboro. I'm glad everyone could make it, and hopefully everyone's been able to stay safe and healthy here lately. Can't miss my bell. There we go. All right. Inspirational moment. The pessimist sees difficulty in every opportunity. The optimist sees opportunity in every difficulty. With Winston Churchill. I believe I have Christy down is introducing Izzy.
Yes. So welcome, everybody. Izzy is the Arkansas state lead for the Nonprofit TeleHealth Access for seniors. After trying to use this 1984 laptop, I may qualify for one of the products that she's about to tell us about. She's a sophomore presidential scholar at Boston College. She's majoring in international studies with the goal of eventually attending medical school and working in the public health field. So please give a warm Jonesboro Rotary Club welcome to Isabelle Jones.
Hello, everyone. Thank you so much for having me. I'm going to share a little presentation that I've got with some pictures and information about what we've been doing. So yeah, as Miss Christie said, I'm a sophomore here at Boston College. I'm coming to you live from my dorm room. I have a week left on campus, and then I'll be heading home for Thanksgiving and have to stay home for finals and everything. So I'm excited to get to come back to Arkansas and see my family and my dogs. So telehealth access for seniors and how students have taken this opportunity to respond to the pandemic and also look beyond in terms of equitable digital access in the coming future. So telehealth has become our new normal in the COVID-19 pandemic. 84% of surveyed executives said that telemedicine is very important. And given that COVID doesn't seem to be going anywhere, and in fact, Arkansas is experiencing an increased number of cases yet again, it's a very important tool in slowing communal spread, as we want to ensure that people still have access to their doctors and primary care providers, but we also want to ensure that they are not contributing to community spread when they go to those appointments that aren't COVID related. So telehealth is most important in continuing care for those in Arkansas as yes. So the reality is that more than 50% of older Americans have 3 or more chronic conditions that require continued care from providers. In the long run, beyond just medical applications with telehealth, it increases compliance with recommendations from doctors. It helps to reduce patient costs and decrease hospitalizations, especially here in Arkansas with the clinics that we've been partnering with. Telehealth is super important as it allows for communication on the internet and areas where rural transportation is not accessible. And for patients who are too ill to travel or who lack that transportation access, it is a very important and vital tool for them to stay connected with their providers. And beyond telemedicine, digital connectivity helps decrease loneliness, increase activeness, and reduce wellness costs. We're meeting here today on Zoom, and I can't imagine what life would look like during the pandemic if I didn't have my phone and my computer and all of my many devices that I'm constantly on for college and just FaceTiming friends and family. So it'd definitely be a very isolating time without a device, and we recognize the benefits that having a device during this time has beyond the simple medical applications. So how can college students who were sent home from their campuses in March to their childhood bedrooms with nothing much to do besides Zoom classes do something about this? So a little bit about our story. So we were founded by some college students at Yale and then quickly spread across the country, and we are now in 26 different states. But basically, on campus, we're involved in lots of volunteer clubs like Rotarians are. And getting sent home was really tough because obviously all the fun of college is pretty much tied to the campus. When you have to do online schools, it's all of the work and not much of the fun. So we saw the big need that was evident, and we realized that college students were in a particular position to help out with all this extra time that we had on our hands. So we used social media, local press, and our own networks to get the word out and ask people for their donated devices. So anything that is an iPhone 4 and up, so any smartphone, we accept. So it's a great way for people who have just old devices sitting around their houses to donate them and allow a person in need to have a use for them. We try to make the donation process as contactless as possible. So whenever someone has a device that they'd like to donate, they can either reach out directly to a volunteer, or they can visit our website and fill out a Google form. And then after they fill out the Google form, one of our volunteers will then contact them and figure out the best way to facilitate that process, whether that is leaving a device in a mailbox and just coming by and picking it up, or meeting in a parking lot and trying to stay as socially distant as possible. And in addition to all of this, we offer printout guides for setup when we deliver the devices. And we also have a tech support hotline that is staffed 24/7 by volunteers to field calls from those who receive a device, so that we can help them through the process of setting things up and ensuring that they have all of the necessary applications to connect with their doctors. So the progress we've made. So just today, we donated over 3,000 devices nationally. So 1,000 of those devices have been donated repurposed devices, and 2,000 of them have been purchased with grant and donation money. We have over 105 partner clinics, and we've raised over $140,000. We've got 400 volunteers in 26 states, and we've been featured quite heavily in some national news outlets. So locally, what we've been doing, I started this up in May and had some of my first volunteers join in June. And our first partner clinic was Mid-South Health Systems, and they had a demand of 14 devices, which we were able to meet by the beginning of July. And then from there, we've been partnering with St. Bernard's in their total health unit. And they have a large demand of devices, so we are fulfilling those as we are able to. So far, we have donated 77 devices. 67 of those have been brand new purchased devices, and 10 of them have been donated devices from the community. We've raised over $2,500 from personal and business donations from around town. So the other Rotary Club made a generous donation in town, Altrusa, First Security Bank, and then most recently, we were very excited and humbled to receive a $3,700 grant from the Craighead Community Foundation, which we were able to use to purchase 40 devices. And after communicating with the nurses at St. Bernard's, we actually shifted what kind of device we were providing for them. So a lot of their patients are seniors and those who are too ill to travel, or those in areas that lack transportation access. And one thing, after we donated the initial devices, they realized that the initial devices we donated were a little bit smaller tablets. And for our next, with using the grant funds, we were able to purchase some bigger, nicer devices, as those with visual challenges where it was hard for them to see the apps. And also for the Parkinson patients, it's easier for them to handle a bit of a bigger device. So we've been kind of modifying and adapting things as we go to ensure that we are having the biggest impact in our local community. And any funds that we raise locally stay local. So anyone who donates from Arkansas, like if you donate on Facebook or on our GoFundMe, the funds that we raise locally stay local. So that is very good to see that those in our community can have a direct impact right here in Jonesboro. And then here's some of our pictures from what we've been doing. So over on the left, that's a picture of when we did a drop off of 37 devices in August at St. Bernard's. The middle picture is our drop off at Mid-South Health Systems that we did in June. And then we have a picture of some great news coverage that we've gotten that has been super helpful in getting the word out about our efforts. Over again on the left, that's a picture from when we did that drop off in August at St. Bernard's. A picture of the grant reception. Unfortunately, I was unable to be there as I was at college, but we had some great representatives from St. Bernard's who were able to go and receive that nice big check on our behalf. And then over on the far right, we have our most recent drop off of 40 devices that was just done a couple weeks ago with one of our local volunteers. So after I tell you all of this, I want you guys to know that we need all the help we can get, as unfortunately the pandemic the end, while it is a little bit closer in sight with the great vaccine news in Arkansas, we are right in the thick of it, and things have to be done for us to be able to limit community spread and really get this under control and ensure that we are able to get back to some semblance of normal and to make sure that everybody is there when we do finally get back to normal. So you can donate an old device. So anything iPhone 4 up. Unfortunately, we do not accept flip phones. I know at my house, we had a lot of those laying around, but the modern telemedicine apps are not compatible with flip phones. But you can donate an old device. You can visit our website, telehealthforseniors.org, and fill out the form, or you can contact me personally and we can get that taken care of. You can follow us on social media. We have our Instagram. You can also like us on Facebook to stay connected with all of our updates and see stuff from around the country about what we're doing. You can make a monetary donation. We have links on Facebook where you can donate, and we also have a donate button on our website. And then just, spreading the word. I know as Rotarians, you are directly connected with the community, and anything that you guys do, of course, people will listen to. So if you are able to share efforts, we would greatly appreciate it. And I think that the biggest thing with this pandemic is that we need to let the 6 feet not be a division, not be a sign of division among us, but rather a sign of our compassion and care for others, that we are willing to undergo that isolation out of our care and compassion for our community. So I would like to leave you all with this final quote that I think sums up what we're trying to do here in the best way possible, and that your old device may have lost their connections, but someone else can use it to make new ones. And those new connections are life-saving during this time. So that is it for my presentation. And I'd just like to thank you all so much for listening. And I am willing and able to answer any and all questions you have.
What kinds of devices are you purchasing?
So we purchase Android devices. So we originally were purchasing Amazon Fire tablets for our clinics here. And then after we got the feedback about them needing larger devices, we were able to purchase a different kind of Android tablet that was much larger in size.
So Izzy, I guess that answers the question. There was a question in the chat about restrictions on the type of device, such as an iPad. So you're mainly focusing on the Android devices, not any type of iPad.
Yes. Well, for the devices that we purchase, we don't typically purchase Apple products just because they're so expensive. But in terms of donations, we fully accept all Apple products,
Okay.
any of that sort.
You prefer tablets over phones, I assume?
Anything actually works. Yes, we accept anything pretty much. And about cracked devices, if it's a small crack, we typically accept it. But if the entire screen is cracked, we don't typically accept those, as in most cases, these days you can purchase a new device pretty much for the same price that it costs to get a device repaired. So we typically just err on the side of purchasing a new device rather than repairing ones that are broken.
Where did you say you take the devices to that you want to donate?
Yeah, so right now we're currently partnered with St. Bernard's Total Health. But if you have a device that you would like to donate, you will be connected with a volunteer, and they typically will come to you to pick it up.
So just call the number, I guess, or whatever.
Yes, you can visit. If you visit our website, there's a link in the top right-hand corner to donate, and there's a Google form that you can fill out, and then we will be in contact with you.
Great.
Do you have the name of a particular Android device that you purchase?
I do not know the specific names of them. I knew the Amazon Fire tablets, but recently the national people are in charge of doing all of the orders. With our 501c3 status, they're able to get discounts on everything. So we typically just do everything through them and use donation money to purchase these devices because they can get those discounts.
No, that's great work, Izzy. That's a wonderful thing you are doing, and hopefully that will help a lot of folks that have access in the future. So I know that's very important right now, especially now.